Although heart disease is the #1 killer of women in the United States, over 500,000 deaths per year, that averages out to about 1 per minute. We realize that only 13% of people realize this fact. Women do not realize that this is the leading cause of death for them.
The University of Kansas Hospital is committed to inspiring and improving women's heart health. As a leading academic medical center, they are dedicated to increasing women's awareness of their risk for heart disease through a campaign called A Change of Heart. This campaign is designed to improve community awareness about heart disease risk factors, provide the screening tools to know your baseline for heart health, and asks women to be an advocate of life-enhancing knowledge by encouraging others to take charge of their heart health too. Together, we can improve awareness and inspire change. It's time for a change of heart. Understanding that heart health should be a priority in your life is step one. Taking the action step to really know your heart health is the real commitment. Cardiologists at the University of Kansas Hospital recommend an annual heart checkup beginning at age 35. This 90-minute heart assessment was designed by women for women to provide a baseline for their heart health, a heart disease prevention action plan, and most importantly, the expert opinion of a heart specialist who understands and can identify the unique risk factors in women.
A screening gives you your numbers and gives you an idea of your risk for heart disease. The next step is, the action step.
Our concern here is that women tend to take care of their husbands, they tend to take care of their children, they take care of their parents and their spouses' parents, and they even take care of their girlfriends. And then last on the priority list, unfortunately, is us.
We also feel like the participants are really a link to the rest of the community, to their families, to their neighbors, to the people that they work with. And we emphasize that because we hear, gosh, we're learning so many wonderful things. And it's something that I know Jan and I both try to emphasize is tell a friend, get out and talk to others about this.
You see a lot of women that come through here that do the heart assessments, and then this heart health assessment was so simple to do. I've learned so much today. How have you changed women's lives with this?
We have actually seen women back in the office. We've reassessed their risk factors for heart disease. We've seen them actually make lifestyle changes, and we have witnessed the benefits by reducing their risk for heart disease.
When I found out that the University of Kansas Hospital was taking a leadership role in educating the community and making a huge difference through Girls Night In, and then the overall program with the Change of Heart, my hand went in the air. I said, this is something that I can really help make a difference. And also getting your companies involved. Again, we've got someone on the committee that has already given that health assessment as a benefit for their employees. I think more people need to get that involved.
I think giving people another avenue for improving themselves and doing some goal setting on a personal level, when you get involved in your own numbers and understanding the numbers that have to do with your own heart, then I think you just become so much more involved with what you're doing to your body. I mean, people should look at, what do I want to be in 5 years as a physical body? Not necessarily, I know in 5 years I'm just going to be older. It's how can I affect how I look and what I feel like in 5 years.
It was nice when Janie had given us the opportunity to think about going through the health screening. As a result in doing that, I think that it's been able to allow us as a family, with me and my kids, to be able to be thinking about leading active and healthy lives.
It was great advice, doable goals. I left with an action plan and a renewed commitment to make sure that all of my girlfriends came and got their health assessments.
The University of Kansas Hospital encourages you to know your heart health through an assessment, just as you know your breast health through a mammogram. Become an advocate for your own heart and for those you love. It's time for a change of heart.